Hello, health heads. Welcome to this dose of healthcare uprising.
I'm your host, Heather Pierce. I've been working in different facets of the healthcare industry for over 20 years.
And I'm your producer, Jeremy Carr, and I have no experience in the healthcare industry at all. Your resident man on the street, as it were.
Yeah, and we're here to inform and educate on all the latest innovations in the healthcare realm, and equally educating and creating awareness around the most basic aspects of the healthcare system. Things like how to use your benefits, what's a PPO versus an HMO, and why Medicare matters, things like that.
Yep, that's pretty much what healthcare uprising is all about. So let's tell them what's on the agenda for today, though, Heather.
So today we are meeting with Piali from Ashmi Health. She is the CEO and co-founder of Ashmi. She also has a PhD in food technology. Ashmi Health is a platform using AI to help women manage hormonal disorders like PCOS through personalized nutrition solutions.
There are multiple phrases in there that I do not understand, so this should be another educational experience for me. So without further ado, let's get into our conversation with Piali from Ashmi Health.
Hi, and welcome to Healthcare Uprising podcast, Piali.
Nice to meet you guys. Excited to be here.
Welcome,
Thanks.
welcome.
Yeah, thanks for coming on today. So, let's just jump right in. Let's get some history here. So, Piali, if you would just share with us your background, experience, kind of what ultimately brought you to establishing Ashmi Health and kind of the origins of the company and kind of where things are at today. So,
Yeah, great. So I'm Pyali. I am originally from India. I grew up in a very small town in India. It growing up, like there was so much of taboo around talking about sexual health, reproductive health, or even something like period. So it really bothered me. I had very bad cramps growing up, but that was something where you can't discuss it publicly. And I wasn't the only one. My cousins, my friends, my mom, she was going through something really severe. So she was in severe pain for a very long time because of her hormonal health, but we couldn't talk about it openly. So what happened is I saw people around us just, hiding their symptoms, not talking about it. It became intense. For my mom, she had endometriosis, but I think nobody other than like just the family knew about it. She underwent a hysterectomy where they removed uterus and ovaries, and she was in such pain, but there was no support available. There wasn't a forum where you can ask questions or when you can get lifestyle support. So that kind of stayed with me. And then I moved abroad. I got a PhD in food technology and nutrition. And I kind of saw this other part of the world where people are so conscious about their health. They are talking about their health. They are doing conscious things to improve their health. And that made me think like, why can't it happen in countries like India? Why can't, especially for women, they're juggling so many different things. We don't have enough time to take care of ourselves. But at least there should be some platform where you can ask questions, where you get support. And that kind of led me towards building Ashmi Health, where I wanted to be a platform where women who look like me, who haven't had any, education or training on sexual health, reproductive health, or even nutrition growing up, they can find a safe space to talk about their problems. They can find a safe space to get advice from experts. And here in the US also, like, women in again underserved communities, they don't have the resources to go talk to a nutritionist, or they don't have the resources to get continuous help. So we are providing them a platform as well to get this specialized care, specialized help. So that is how I started this company. And yeah, very excited to talk more about it.
yeah,
Can I start with a question?
you sure can.
You said you have a PhD in food technology. What
Yes.
what is food technology exactly? What do you actually study when you get a PhD in that?
Right. I can talk about the PhD itself. So what I was doing is Have you had these plant-based oat drinks?
I
They,
haven't.
I drink a lot of almond milk myself.
yeah, so
Yeah,
it's like
almond milk. Yeah.
something like that, but we were adding a lot of fibers and we wanted to make it really nutritious. The challenge was people weren't liking it. There was the company that I was partnering with during my PhD, they weren't able to sell as many products. So, as a food technologist, what I was doing is connecting the ingredients to what is exactly happening in the mouth. So, looking at the physics of what the particles are doing, how is it rubbing against your tongue and palate, and how that we can translate that to user experience. So what would make people to eat or drink more healthily? What are the challenges
Hmm.
that we can solve through technology? So we decided on a new shape structure of the particles that kind of enabled a more smoother experience
Wow.
in mouth. If you can imagine like mouth feel like when you drink your coffee, if you have something, some particles in there, how it feels,
Mhm.
versus like a very creamy experience when you add milk and cream. So we were designing those kind of experiences by changing the physics of the ingredients.
Wow.
That is very Star
You're
Trek-y.
like molecular engineering food.
That's wild.
Yeah, so it's basically engineering, but as a system, we have food, and as users, we have human beings. We use them as kind of like with design experiments where we feed them different things and look at their responses and talk to them and try to measure how they're feeling about the food. It's always about the feeling, like what are you thinking? What are your childhood experiences around that food? What would enable you to, think more about it. So it's all about the feelings. It's very interesting connecting engineering to human
Yeah.
feelings.
It's got a little bit of Willy Wonka in
The
it. In
schnozberries
a good
taste like
way. In a good way.
schnozberries.
In a
But
good
like
Uh,
way.
the soda that makes you float and
yeah.
Mm,
things like that. The blueberry stuff that turns you into a blueberry.
Yeah.
yeah. And we realize like a lot of it is people's childhood experiences, what the
Mhm.
experiences were around food, what smell or what memories come into picture when they think of foods or some sort of an experience, like, oh, my grandma made this, or we had this Christmas thing, that this is a special thing. So most of these foods revolve around ingredients which might not be good for you. So it is very hard when you bring in new diets or new ingredients. So that was the challenge. That is what we were working towards, like how to make new ingredients look and taste like something that you've already tasted, something you already
Mm.
have memories
Like
around.
the Impossible Burger, right? Kind of
Exactly. Yeah.
idea,
Yeah.
which I've never had one of those, by the way, but
Well, it's almost like the reverse of what the candy and soda people do. They try to engineer their food to basically be addictive and like make you want more, more, more. You're
Yeah.
doing a
Yeah.
similar thing, but you're aiming it towards health rather than,
Exactly.
just consume.
Yeah.
that's
That's cool. That's
that's a
yeah,
really
like
interesting way to
turning
look at
because everybody's heard of how the candy and soda people do it. It's nice to know somebody's doing it on the good side too. That's
it.
good.
So obviously you've spent a lot of time. Your bio and your background is quite interesting with the food technology and some of the things that you were doing around plant-based, which is fantastic. But Ashmi Health, obviously, it's an app, right? It's around hormonal health. And food plays into that. I mean, nutrition, we've actually had a number of episode interviews recently where there's this common thread, and I think it's just kind of in the universe now about, food is medicine and how nutrition and what we put into our bodies is so important. I mean, it's always been important, but now we're actually doing something about it and becoming, I think, a little bit more conscientious. So, in terms of like the actual app itself and what you're doing with Ashmi Health, like how does food play into that? Like, can you talk a little bit about really what the app intends to do? Just really kind of all the things so that we can understand that and how who might want to use it too.
So how it started, or how I actually started, was designing these nutrition meal plans for my friends and family. And what happens is they're excited, they try it for a few days, and then drop-offs happen. Motivation kind of lowers down, and people are not interested anymore. And this was a recurring theme for a while, and that made me realize that more or less, we all know what is good for us and what is bad for us. But what happens is when life happens, like you're busy, there is stress, there are so many different things to going on in your life. It's really hard to stay on top of everything. It's really hard to plan your food and plan your, wellness activities around that. So that was a big, thinking point for us. Like, how can we use tech to make all of this easier, to not have people to think so much of how do I eat the best thing possible. So that is where AI comes into picture, where AI can actually make these experiences very personalized. And we realized when your whatever recommendations or whatever learnings you're getting is personalized for your own needs, there is more adherence, more and more people are interested. So this is what Ashmi Health is doing, where we look into multiple data points. So as I mentioned before, hormonal health, menstrual cycle, symptoms, your sleep, stress, all of these are really important in managing your health. So we make sense of all that data points and use that to design these nutrition insights for you. And it's not like a static plan. It's not like go on keto for 3 weeks. These are very bite-sized recommendations that will keep changing as things happen with your life, or as you are giving feedback to the application that this is not working for me, or I want something different, or like, let's say your cultural preferences are different. So this interaction keeps happening. And the other innovation that we have is the companion. So we have a health assistant system built in where users can come and chat. So they talk about their hormonal health struggles, but this is also the accountability partner, which provides them nudges or motivation when all of these, you're also dealing with life and other stuff. So the app is like a combination of a nutritionist and a companion or a friend like system that not only just provides you advice, but also follows up and helps you keep on track.
So trying to think about like your maybe ideal user. Is it somebody who has some kind of condition that they need to manage? Is that kind of your idea? I mean, could it be anybody, but also is the maybe who gets the most benefit out of something like this would be
Yeah.
somebody who's maybe dealing with a chronic issue, a chronic condition, that inflammation from certain food, right? Like if you eat and you're tracking it, it'll say, "Oh, I felt really bad," or, it made me feel this way. Okay, don't eat that food. Maybe try this. Is it kind of along those lines?
Yeah. So to start with, we were thinking of PCOS, but as we kept building and talking with the users, we found a lot of interest from women who are either trying to get pregnant, is going through pregnancy and postpartum. And like I have my personal experiences, like during pregnancy, I was at risk for gestational diabetes, and I knew, okay, I have to eat or not eat those things. But then every week is different. Your body keeps changing, your hormones keep fluctuating so much, and the static recommendations do not work anymore. And this is what a lot of our, early users have who are going through a similar situation have told us. So right now, our first, these target users are women who are going through these very drastic hormonal changes, where we kind of look at their symptoms or give them a space where they can track their symptoms. We tell them what is going to happen. Maybe it's going to happen in the next few months. And then we have these nutrition recommendations that keep changing as their needs and their hormones are changing.
Okay. So it's kind of as you're talking, I'm thinking you get more out of it based on what you put into it. Is that kind of a fair statement
Exactly. And
too?
that's how most AI applications work. The more you
Yeah.
use, more data you provide, it gets all the more personalized. But that's the thing, like there is this initial friction involved where you're asking people to put in a lot of information and not getting value straight away. So this is where our health assistant comes into picture, where we are already giving you value because of all the data that we have accumulated. Our AI models have been trained on clinical data. So we can already give value even if you don't provide any data itself. But as you get used to the platform, you start using it more, users are providing more and more information. And then the personalized experience is just getting a lot better with usage.
And is the app internally generative in that it will add the data it's getting from the new users into the data it already has and keep
Yes.
updating its information on its own?
Exactly. So it keeps updating, and we are also getting data from other sources. We have some partnerships with research organizations. So we also have access to clinical trials. So that is also kind of, making our models more intelligent. And women's health data, it's not something that is readily available. So we are lucky that we got access to some very good quality data, and we're getting access to more and more. So we are kind of, always training our models to get better.
Yeah, and the more people that sign up, the more info it has to work with, and the better everybody's process goes in the end, right? I mean,
And
that's the
also,
concept.
with this kind of data, diversity is really important. Again, the clinical trials we are talking of, mostly based on Caucasian women. A lot of our users, I think 70% of our users are based in India. So
Oh,
we
wow.
have this diverse data. So we know that, something that is working for the Caucasian woman might not work for an Indian woman, might not work for a woman based in Nigeria. So at least to start with, we have an Indian cohort of women using it, and women in the US using it. So we still have some diversity just starting out. So that is very, very interesting.
Well, let's bring this thing global and make it really work for everybody here.
Yeah, we
It's a
do live.
global problem. Like,
Yeah.
like
Oh,
you,
yeah.
everybody can relate that, yes, I have that problem as well. So
Mhm.
it's a very universal problem. The nature of it is like nobody is like very happy with what food they're eating or their lifestyle. There's always some challenge associated with it.
Yeah, doesn't matter what country you live in or where you live. We all struggle with that, and also too,
It's either not enough of this stuff or too much of that stuff
yeah,
or
yeah,
Yeah.
PCOS
something.
and endometrial. These they don't have geographical boundaries.
What
So,
They
what is
don't have.
PCOS?
oh,
It's
shoot.
Is
it
that my
is
next question? What is
I
PCOS?
mean, I feel like PCOS is probably one of the conditions that is common, I would guess, for somebody who's using this app. I feel like we
yeah.
maybe have talked about that when we met briefly. So, yeah, let's use this as an education opportunity.
So it's polycystic ovary syndrome. It's a condition where you have cysts in your ovary, and there are a lot of different symptoms that kind of spin out. So your periods are not regular, and that also kind of causes cysts in your ovary. And then you have this unexplained weight gain for a lot of women. You have insulin resistance, where your body cannot process insulin well. Again, that leads to weight gain. Kind of, if you keep continuing that path, some women also go into infertility challenges. And then if all your symptoms are there and you've not really taken care of it, ultimately it can cause, diabetes or cardiovascular disorders. Now, the biggest challenge is there is no cure for this condition. So you can just manage the symptoms. And the way it is done these days is through hormonal contraceptives. So you are asking your body to stop producing the hormones. And you can imagine when you just stop a natural process, again, it leads to further complications.
Mm.
So it's basically like there
The
is no,
domino effect
Yeah.
of,
yeah, it's a
yeah.
domino effect. And when women go for medical help, they are told that, okay, because you're overweight, that is why you're having all of these challenges, but this condition itself causes you to gain weight. So there is no help available. When you go to lifestyle management, that probably would work, but again, every PCOS is different. Women, every body is different. How you're processing what is happening is different. So again, there is no customized help available. So it is a big challenge, and more women are getting diagnosed with PCOS. It might be because, the women are actively going to doctors and getting themselves checked, or, our environmental factors are such that we just start having these conditions more and more. But it is a very serious problem.
Yeah. I know a few
Yeah.
people who've had PCOS and infertility being one of the symptoms or outcomes of
Yeah.
that. So, that can be pretty devastating for a woman, especially if she wants to have, you know,
Yeah.
her own children.
Yeah.
So, yeah. Question for you too, and we didn't really talk about this in when you were kind of giving your intro background. Ashmi Health, how long has it been around? And you just mentioned obviously 70% of your users are in India. It's just where I'm sure you launched it and it will be global or becoming global. But how long have you been around actually? And
Um,
what are the
Almost
big
a
goals?
year, a year. We started, like we built the beta last year, I think around February last year, and then we ran that for about 8 months, and that is when we started getting our users. We got a lot of interesting feedback, and that is when this concept of a health assistant came into picture.
Mm.
And we just finished building our health assistant last month, and now we are testing with our first set of users and getting all the feedback, and then we start building the next version of the product.
Gotcha. Okay. I knew you were really new, but I wasn't sure how like active, and we have a lot of conversations with a lot of founders like yourself with these kind of early startups. And so everyone's kind of at a different place. And so it's interesting to hear. So are you going really more for like the direct to consumer, or are you looking to partner with providers? Like where do you see Ashmi Health presenting itself, I guess, to get more folks using the app?
So initially direct to consumers as we, learn more about our consumers, learn if you are actually solving their problems and define or design our product accordingly. We're also getting interest from other health tech companies that are getting requests from their users to have nutrition insights, which has been quite interesting. So we are still early, we're still kind of, navigating those relationships. But going on, we want to really have a partnership with providers, insurance companies, so that nobody has to like it happens through insurance, which ideally it should be. So we're still early in kind of having that relationship, but this is what we want to head towards.
That's those are some pretty big goals. But there's an appetite. Hey, look at me being funny. Um, pun intended or not, but there's an appetite for it. And I think, that's one of the things, and maybe you can talk about this a little bit too, is we have become, and Jeremy and I were actually just talking about this yesterday. It seems like the shift in healthcare is that us as like the individuals, the consumers, the humans, whatever we call them humans on our show, um, that we have to really take control of our healthcare, right? Like we're getting more of that power in literally in our hands, right? Like in our phones. Um, are you seeing that shift from the spaces that you work in, the other founders that I'm sure you talk with? I know that community is really tight. Like what do you think's changing other than the fact that like AI and tech are huge,
Yeah.
but do you think it's something else in the universe? Is it just attitudes? Is it, I don't know, just people thinking more conscientiously about their health and they want that control? I just feel like we've always been such a reactive society and now we're changing, that. And it used to be just a healthcare thing. We need to, preventative care and value-based care and that's a lot of places that I've worked in. But now people are actually becoming part of that formula to push this forward and say, I'm demanding this. I want an Amazon for my app or for my health, that sort of thing.
I think it's a combination of everything. So if you look at the healthcare system, it is overburdened. If you have to see a specialist, you have to wait like 4 to 6 months. So think about it. You're having PCOS, you're in intense pain, or you're bleeding for a month straight, and you can't see a specialist. So there is a lot of frustration. And even when you go to the doctor, a lot of time you're gaslighted. You're told that your symptoms do not matter, or because you are, like as I mentioned before, because you're overweight, that is why you're having all these challenges. So women are not getting the help that they need. So they are frustrated. So this is one big thing. And then the other thing is medication. Like once you take medications for a while and you face all these side effects, you start thinking like, what is really happening? Like I can't be like, this can't be my life, right? I have to get a better life. And this is where, holistic healing and getting like something which is non-medical, has no side effects, and can actually look at the root cause and solve it at the root. This is where it comes in, and I think Gen Z is a big advocate for that. Like food as medicine, I think this concept is kind of driven by them. They are more vocal about it, talking about it with their friends, and that kind of has seeped into these other generations as well, where we are thinking, okay, this is actually possible. We can actually start eating well, and that is affecting our health. So there's a lot of awareness around it, a lot of buzz in social media, which has definitely helped, even though there is some misinformation. But I think this buzz is actually driving this entire thing forward. So that's really good news.
Yeah. I know it's interesting with the food as medicine kind of revolution. It's
Yeah.
seemed to gathered some steam here, I feel like in the last five or so years.
Yeah,
So
I think there was always this interest, but there weren't any actionable insights on what exactly to do. And this is where, this AI and tech has come into place, where we can actually analyze huge amounts of data. We can make experiences very personalized. We can have something on our phones which can, track. So we have such good real-time data that we can actually make sense of it and have something that works for your bodies. So this gives people hope that, okay, this is easy. This is not as difficult as we thought it would be. So again, helping all that movement and helping people to realize that we don't have to depend on just the healthcare system. We don't have to, go to the doctor or think about our health when we get really sick. We can do something every day to improve our health.
Yeah, and I think it is a cultural shift that people are becoming more proactive about such things, just generally. Because,
Mhm.
I mean, it's been a long time now, and more and more so. There's kind of a you're on your own sort of approach to healthcare in America, and I think people have finally realized, okay, if it's up to me, then okay, let's start doing something about it, and let's give people the power to actually do that for themselves. And a lot of our episodes have been about such
mhm.
things. Like I don't know, probably a good half of our episodes to this point have some kind of aspect of that in it. At
Yeah.
home testing and apps like this, and
Yeah.
even the social prescribing episodes we're doing. Like, there's people out there, helping other people out and getting insurance companies to pay for helping with their depression kind of stuff. Like, I really do think there's a cultural shift going on in that. And I didn't know that until we started this podcast. It's, once again, it's part of the whole uprising part of this that we're bringing this information to people and showing them that it's not all just gloom and darkness and melancholy when it comes to American healthcare. There's actually people out there trying to make it better for everybody, which is great. So
Yep.
I appreciate what you're doing is the short
Yeah.
version of that.
We're here. We're literally here for it. And yeah, it's, it is that education piece, I think, and social media, for bad or for good, in terms of the existence of it at all. I mean, we get some benefits out of it. And I think one of those things is that sharing of information that we didn't have,
Yeah.
I'm even thinking back, when I was younger, in the 90s, when we were teenagers, Jeremy,
Back in the 20th century.
woo, yeah, but we didn't have this kind of access to information, and we have that now, and so we're empowered with that, and then the healthcare system itself. I think it's just the healthcare system just got so complex and complicated and kind of I described it yesterday as it's like adding things onto a house, like
Yeah.
multiple additions, and then ultimately things start falling apart and they just don't make sense, And so
Ventilation doesn't work right because nothing's
yeah,
connected right.
exactly. You
Too
open a
many,
door
too
to some
many.
weird, creepy hallway that, and so it feels kind of like that. And so I think with apps and organizations and people like you, with Ashmi Health, you're empowering us to decide how we want to build our houses, right? Like, and it's kind of our domain. And insurance is a much smaller part of it now. Insurance is kind of like the underlying, like, okay, well, we're going to pay for this, bit, this, and this, and that, and the other thing. But like everything else, right? Like all the apps, the food parts, the mental health, everything else, we get to decide. We get to control that. And I think that's kind of maybe one of the most beautiful things that has come out of COVID, quite honestly, because so much of this did happen while everyone was locked up in their houses for 2 years, you know?
All the good ideas happened during that time.
Yeah.
It was, hey, we
Huge
have so
advances
much
in
of time.
telemedicine.
Yeah, yeah, really. I mean, we were forced. How many companies, people I've talked to that we've talked to that said, well, I had to figure out how to pivot really, really fast so that people could access what they needed, virtually or out of out of their homes some way. And so, if there's one silver lining of COVID, we've got a lot of great healthcare tech companies that were born
And
out of
a lot
it.
of
So,
behavioral changes also happened. People also
yes.
started realizing, like, wow, my health is so important. Like,
Yeah,
if
that's
you don't
true.
take care of it now, you have these very severe consequences later on.
Mm.
So, again, something
Gosh,
good.
when you're not so busy running around and you have time to actually stop and
And
take a
then
look at your life.
think about what's really important, right? Like,
Right.
It was quite a moment. Everyone at the same time was forced to stop and look
Mhm.
at their own life in a real way,
Yeah.
all at the
Yeah.
same time. You're going to
See,
get cultural shifts out of that. It's going to happen, especially with the high pace. Yeah, the go, go, go. Don't stop to think, just go kind of
yeah,
And just
attitude we
do
had
it.
before that.
that's interesting. That's true. And kind of bringing it back to this food and nutrition part of it, Piali, because that's obviously where you've spent a good amount of your time at food technology. I'm still like just absolutely fascinated by like food technology and what all you were doing. Um, what what have you seen change like from a nutrition perspective and just kind of and maybe it is behavioral shifts, right? Because food is so hard for people, right? Like to eat well and to eat well consistently and to create those habits. Um, what do you see from your perspective around maybe some of the challenges or like how do we change people's behaviors? Is this app one of those ways to do that, right? Because it's almost like having, I don't want to say a personal chef because they're certainly not in your kitchen, but I think that's one of the hardest things for people is to figure out what to eat, right?
Exactly.
Without, I always say, God, I wish somebody would just tell me what I need to eat, you know?
Yeah. So I think behavioral shift is very difficult to achieve, and especially like you can achieve it for a small duration of time, but like having build that as a habit. So just this morning, I was in my Uber and my Uber driver said, "Oh, you're doing this. I was so good with my food and I had everything in track. And then I moved from Florida to Cape Cod, and bam, I gained 50 pounds in what, like a month or so. And this is what happens, right? Your life gets busy, everything happens at the same time. It's really hard to keep everything in track. So we are not really bringing behavioral shift like that. We are just making it easy for you to do the things that you're already doing. So what we have seen that, like, let's say you want to go to the gym by yourself, it's hard to do it after a while. But if you have your partner or your friend going with you, it makes the experience a lot more easier. You have that accountability partner. So we have realized, like, if there is that gentle nudge or some companion like thing, that really, really helps. Now, we can't really have a companion. Not everybody can have the luxury of having a companion all the time. And this is the experience we are creating through AI. So again, the tech has made AI very personalized. We can send really personalized messages that can mimic human emotion or human companionship. And this is, I think, the real difference that we are making, where we are making a person feel that there is somebody out there for you, who understands the struggles, the daily struggles that you're going through, and I will help you stay on track. So, for example, for our cohort of pregnant women, we are helping them look at, doctor's appointments or keep track of their appointments or understand, what all do they need to even think about when there's a baby coming in. So all of these little things that kind of add to the mental load, we help navigate that so that you don't have to worry so much about what to do. So making it just easier to follow a diet or making it easier to follow specific plans.
Do you have actual social spaces on your platform for the actual users to interact with each other? Like if they have similar problems, is there a chat space so that they're not just talking to the AI, they're actually really
Yeah.
talking to other people?
That is interesting. So community is something that we really want to create. So maybe that's going to be like our next thing that we build once we test out the existing features. Because we have seen like community really helps. Like you have these Reddit platforms with thousands and thousands of users and women helping each other, uplifting each other, being there for each other. So we want to kind of have that space. So it's not just AI and human talking, but real humans interacting with one another and motivating each other. So that's something we do want to build in future.
Yeah, that would be a great addition to that, I think.
Yeah.
Yeah.
Yeah, community. I mean, I would say just going back to social media, at least one of the only redeeming qualities of Facebook anymore are the groups because I love the community that you get there.
Yeah.
Otherwise, you got to pay for your posts to be seen by anybody. So, but
And
the
you
groups are
can,
great.
if you're struggling with something and you see somebody else also going through the same thing, it gives you hope. And then you
Yeah,
learn like, okay, how this problem was solved by this person. So
yeah,
it's
yeah.
very hopeful, gives you
You're not
positive.
alone, right? That's people don't they need connection. They
Yeah.
need understanding and yeah, communities certainly, especially women, right? Women like just
Yeah.
crave community and connection, and we just need
Yes.
others in our lives. It's just what it is.
And
So,
sometimes you just need to vent, like
yeah,
just have to talk about
absolutely.
your problems.
Yeah.
Yeah, like someone who has the same problem will understand your problem.
Hmm.
People
Yeah.
who don't have the problem aren't necessarily going to really understand what you're going through. So
Yeah.
it would be, and a lot of people, I'm sure, especially, you know, women having issues that only affect women, it's that much less likely there's someone in their direct life that has the same problem. So yeah, it'd
Yeah.
be great if they could like just go on that platform and be like, hey, who else is dealing with this? Because I need to rage for a minute. And somebody who understands their rage will rage with them. Makes you feel better.
Sometimes it's easier to talk to strangers than people within your family.
Yeah,
Yeah, that too. There you go.
that is
Yeah.
true. And actually, speaking of the people that might need to rage in a community setting or at least vent in other ways, um, from the people that have been a part of your beta test group last year and anyone who's in it now, can you share any like anonymous like positive outcomes that you're starting to see just to show really how valuable the Ashmi Health app is for these women?
Yeah.
So.
And there have been so many. I'll share just one. So there was this person, and she's a friend of mine. So she gained this huge amount of weight in a very short time, and she had insulin resistance. And again, no idea of how food is affecting her body. And she spent 5 years trying to figure out. So after she came into our platform, so a lot of in our beta, a lot of it wasn't automated. It wasn't through the app. So I had to do manually. So kind of had these consultations with her. And that made her realize like what is the real problem. So she didn't know she had insulin resistance. And the doctor was like, oh, you have to do these exercises. You have to like have like a 1,200 calorie diet. And it doesn't work for her body. So when her body is put into such intense stress, whether it's physical or whether it's through restricting her calories, it kind of increases her cortisol and it just makes the whole situation worse. Now, not having that information and living with that frustration that, oh, I'm not even able to do this, or I'm not even able to restrict my diet, I'm not even able to go on, run every day. So she lived with that guilt and shame for years. But after she came to know that her real problem is something completely different. So now she knows better, like she has to eat better. She has to eat more nutrient dense foods rather than just empty calories. And last time I spoke to her, she lost almost 30 pounds and she hasn't gained back the weight. It's still like she still has lost that weight and that is still doing really well. And her mental health has improved. That is one really important thing is once you're trying to, reduce weight or you're bothered with the symptoms, your mental health kind of declines, and nobody takes that into account. So very, very interesting, all of these symptoms, like not just the real symptoms, but all these associated things that happen. That is where, I think a real value comes in. Like, we're not just reducing PCOS symptoms, but we are kind of changing the other aspects that can be affected if you have a condition as severe as this.
Amazing. I love hearing a good success story.
Yeah.
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 Yeah. It's food is everything. It really does just play such a huge role um in our
Yeah.
lives. Both
And
from a, connection and community perspective, right? Like
yeah,
sharing a meal with a friend, there's something about, family dinners and then the actual food that you put into your body
that's
and how
very,
it
very
how it impacts you. And it's such a central piece of the human existence.
Is
yes.
there a focus in your practice at all with eating natural whole foods as opposed to processed and like
Yeah, so
artificial flavors and like GMOs? Is that a thing that like is that a tool that it depends on how you use it, or like do you have
that is
thoughts on that
definitely
generally?
there. The more natural and the more better foods you eat, the better you get. But we also have these restrictions. We can't always eat like very clean, all natural foods. So it is also about understanding how different foods are affecting you. Like, if you know about, continuous glucose monitors, they have found a cookie and glucose relationship. It is different for different people. For some, the change is very drastic. For some, it is not. For some, if you take a walk outside, your kind of glucose gets back to normal levels. For some, it takes more time. So with our app, when you're tracking so much, when you're getting so much of data, you also understand all of those. You also understand how seemingly junk food affects you, so that you have better control of deciding, okay, should I eat it now, or how should I, plan my junk food so that it doesn't really drastically impact my health. So it's also like a visual tool to see how different kinds of food is affecting your health. In the perfect world, we'll all be eating clean foods, we'll all be
Sure, sure.
doing,
So,
yeah,
so it
but
really is like, so your platform really is very personalized to the specific user. Like it tracks you and applies it all the known data to you and your physiology and your diet and everything like that. Okay, cool. That's pretty cool.
It is.
That does differentiate it from the other ones we've been talking about on here too. They all kind of have their own specific niche and their own specific approach, which is cool.
Yeah,
Yeah.
they do. Um, as we begin to wrap up here, I have one question I want to ask you because I think it's important to know these origins of names because I love understanding and knowing where the names of these cool new companies. What does Ashmi stand for?
the Ashmi is a Sanskrit word. It means strong, resilient. Uh,
Oh,
so I really like the meaning, and I think looking back when I was looking at names, it kind of reminds me of my mom particularly. So as I mentioned, like, she had endometriosis and she was in so much of pain, but it never affected how we were brought up. Me and my sister were brought up as kids. We got all the care, everything that we could from her. So, as women, even though you're going through all of these, life-changing symptoms, you still manage to do everything that you plan to do, right? You're just strong, resilient women who are extraordinary. So kind of Ashmi is a reflection of those women, celebrating those women.
I love that.
All right.
All the names of the companies like yours that we get to meet have really great stories and meaning behind it, meaning behind the names that they choose, just like this, but also the reasons that they start the companies to begin with. They always seem to be initiated from personal experiences that inspire them, and I don't know, there's just something about that that just makes makes my heart happy. I love it. I love it. So, any big achievements, milestones coming for Ashmi Health that you want to share with us as we wrap up today's chat?
Yeah, our biggest milestone was just finishing building the product and now testing with our users. So we are like continuously testing and continuously building and refining the product, and we are really happy with what we have achieved in what 2 months' time. So very happy about that.
I think it's cool how early we got you on. We're going to be one of the first to bring you to the world here. Hopefully it helps.
Yeah, thank you for that.
Just yeah, just remember us when you go big.
That's right.
Oh,
We'll, we'll
definitely.
bring you back on when everybody's on your platform and see
That's
how
right.
it's going.
That would be
Yeah.
amazing.
Yeah, that's exciting. So where can someone find you online? Obviously download your apps on the regular app locations, but share your website, anything on social
Yes.
where we can
So
find
it's
you.
on our website. The application is on our website. We haven't launched it on the App Store yet, this
Oh,
version.
okay.
So it's still on the website, but people can go onto the website and try and test and give us feedback.
Yeah, that's ashmihealth.com, right?
Yes, yes, Ashmi Health.
ASHMI. Okay.
ashmihealth.com.
Got it. Okay.
And
Awesome.
we'll put that in the show notes as well.
We will. Absolutely. Yeah. This has been again another enlightening, fascinating conversation. We really get to meet some of the coolest, interesting, most brilliant people who have gone to literally some of the best universities and colleges in the world. And how lucky are we, Jeremy, that we get to talk with all these
Yeah.
brilliant
Yeah.
folks? You guys are doing some great stuff. So anyway, thank you, Piali, for coming on the show today. This has been really helpful for us to get yet another perspective and another great product coming on the market for women and empowering them in their healthcare journeys.
And thank you for the amazing questions. It was like so interesting. Like even when I'm thinking, I'm like, oh, okay, this is food technology. And
Yeah,
maybe a lot of people don't really know, like, this is a real job and this is what really happens. So it was amazing, talking about that.
great.
Yeah, it's cool to meet somebody who actually does that stuff. Like you hear about the scientists in the lab making the new foods and stuff. But it's like it was an abstract concept in my mind
Yeah.
until today. Now I have a kind of a face and know there's
Me
real people doing real things that that making that
You
stuff
will be
happen. So
surprised the extent to which research happens. Even like something like your potato chips, the way it breaks and the sound it makes, there has been like extensive research done on
Wow.
that to
wow.
make it actually crispy and have that experience. So
And it really breaks down like you go all the way down to the molecular level kind of thing, huh?
exactly. You
Wow.
go down to the smallest level possible and try that to the user experience. So
Mm.
very, very
Wow.
interesting stuff.
That's why we can't read our ingredients lists.
Right. Exactly. Well, again, thank you so much.
And there you go, our conversation with Piali from Ashmi Health. Once again, learned a lot. I know what food technologists do now, in a way. Very Willy Wonka, actually. I appreciated that aspect of it. I hope she didn't take that wrong because there's mad respect in me for Willy Wonka. But anywho, I'll stop rambling because I went off on a tangent immediately right there. What's our main takeaways from that, Heather?
Not surprisingly, the role of food and nutrition in healthcare, and especially in women's health, based on all the different phases of life we go through, between you know, pregnancy, post-pregnancy, perimenopause, menopause, all things. And it just affects certain conditions in bad or good ways. And it's just becoming more and more a part of healthcare plans, just the role of food,
Yeah.
which is not terribly groundbreaking. Like, yeah, we know food's important, right? We all know that like what you put in your body can be great for you and it can also be really bad. But what they're doing with Ashmi Health in particular, focused on women's conditions, like PCOS, endometriosis. I can't say that word. Whatever. Let's continue. um, it's like food literally can cause issues that then have that domino effect. And so I think what they're trying to do with this app and like getting that control over the nutrition piece of it to help manage those conditions better and have better outcomes is pretty awesome. So,
Yeah, you don't want to put sugar in your gas tank, you know?
yeah, exactly. And then also too, AI, this is a common topic or part of our conversations on the show. So, and with Ashmi Health, AI plays a really big role as a tool. So, and it helps us guide us in making better decisions for ourselves because sometimes we need to be told what to eat because
Yeah.
when you're left to your own devices, you're not going to make good choices. You're going to eat the pizza and the burgers and grab the bag of chips and all the things. And like I said, oh, wouldn't it be nice to have like a personal chef? And not that that's what this is, but to get guidance when you have particularly when you have like a health condition that makes you feel pretty bad, right?
Yeah.
To be kind of guiding you on what to eat. I mean, that's quite a handy tool in your pocket.
Yeah.
So,
And the fact that it's not do this diet and like very strict diets with very, extremely limited things that you can do, they don't really work for people. I love the dynamic kind of kinetic nature of this where it's very personalized and, try this. And if it doesn't work, try this. And if it doesn't work, try this. It's not dropping you in a box. And like, if this box doesn't fit, there's nothing else we can do for you. It's
yeah.
let's learn who you are and then find the things that work for you.
Yeah.
And there might be a process of elimination and stuff, but in the end, it's a much more useful approach than most people will take to that stuff. Yeah, that I've heard of in the past anyway.
Yeah. Yeah. And I think the other thing too, I want to make sure I mention that we talked about is the importance of diversity and how we look at groups of, in this case, in the users of an app, right? Or just in clinical trials and clinical anything for that matter. Because cultural, ethnic origins, backgrounds, things like that play a big role in our personal health. And so you can't just, beta test with white women, right? You have to get other types of people into your kind of test group to gain a real true understanding of what you're trying to do in order to create something that can help everyone. Because the goal isn't just to help one group of people, it's to help all women.
Yeah.
No matter the color of your skin or the country of origin or the cultural, specifics, right? From one country to another. We have different.
It's like the
Yeah.
role that the WHO, the World Health Organization, is
Yes.
actually a great thing because it can globally gather that data. It's not country to country and population based to population base. It's the whole thing at once, and you can learn so much more about what's really going on with people that way.
Yep. Yep. Sickness
And this is kind of
yeah.
that sort of approach. If you can get this sort of approach to go global on these different platforms and have the proper types of AI, generatively building the data and building the proper responses, then I mean, ultimately,
Yep.
it's great for everybody.
Yeah,
Like, it's
illness
literally
and
good for
conditions
everybody.
don't have geographical boundaries. They don't
Right.
know where one country ends and begins.
Right.
So, yeah.
And but at the same time, we all are our own biosphere. We all do have our own physiologies and different things work for us on individual bases. So combining those two things is tough, but it sounds like there's a lot of people working on it right now, which
Yeah,
is cool.
both are important. So,
All right. That's some really deep thought. My brain hurts. Can we go now?
yes.
You can find us on, if you like what you heard, you can find us on all the major listening platforms plus YouTube. And if you like what you heard, please hit all those happy little fun buttons before you go, the likes and subscribes and shares, things like that. And if you really liked it, we have a Patreon you can join for as little as $1 a month, which really supports the Uprising. You can become official member of the Uprising there. That's patreon.com/healthcareuprising. Where else do they find us, Heather?
You can find us online, healthcareuprising.com, and also on all of the social media channels like LinkedIn, Facebook, Instagram, Blue Sky. Just search Healthcare Uprising Podcast and you will find us pretty easily. And yeah, I think that's about it.
There you go. Take us on out of here.
Until next time, keep looking for the good in the world. Sometimes it's where you least expect it.
This has been a Shut Up production.
Shut up!